Hi and welcome to Heal My Hemorrhoids. In this video you will learn prolapsed hemorrhoids are, so watch the whole video to the end to get all of the tips you need to treat hemorrhoids when you got them and to prevent from getting hemorrhoids. Remember to hit the subscribe and like button if you like this video. In a sense, everyone has hemorrhoids and that's not something to be worried about. The lower part of the rectum where the veins are situated and the part where the mucus layers sheath under are called hemorrhoids. Under normal circumstances, it's completely harmless. However, it gets serious when the veins get inflamed and enlarged. If you feel a lump inside your anal canal and have difficulty moving bowels, then you might have prolapsed hemorrhoids. The symptoms include bleeding sessions on bowel movement and extreme irritation around your anus. For self-care treatments for prolapsed hemorrhoids you can try ice packs, witch hazel, coconut oil, frozen, or straight on the hemorrhoids. Over-the-counter creams are one possible help too. The veins are constantly fighting and should be fighting gravity to return to your heart as the heart pumps blood. But people with hemorrhoids get their blood veins inflamed and the blood pumping gets stopped. At the point when a vein in your anal canal or lower rectum gets enlarged due to inflammation, it's known as hemorrhoid. As we've already stated, everyone has hemorrhoidal tissue as a feature of our physiological structures. But the serious forms of hemorrhoids are seen in a minor amount of people. And they do have to bear this unfortunate health issue where hemorrhoids become enhanced or regardless of characteristic. Hemorrhoidal tissue is seen in the anal canal and perianal area and inflamed veins, connective tissue, and a rare case in some part of the muscle. There are two kinds of hemorrhoids: internal hemorrhoids, which occur in the lower rectum, and external hemorrhoids, which are seen on the skin around the anus. External hemorrhoids are the most serious ones and frequently seen in most patients because the external skin gets the most exposure. Internal prolapsed hemorrhoid. When blood veins get swollen inside external hemorrhoid, the pain can be extreme and unbearable for pretty much everyone suffering from it. You may feel or see bleeding around the anus. The coagulation typically separates the area inside your anus, leaving swollen veins. But the after effects are usually more painful and irritating. Only the patients suffering from prolapsed hemorrhoids know the pain it causes. External prolapsed hemorrhoid. The other sort of hemorrhoid is external, and it can be seen directly from your anus. External hemorrhoids can prolapse as well like the internal ones. The rectum is the most minimal segment of the digestive tract, and the anus is the opening at the lower part of the rectum. That's the part where bowel movements are released, but external prolapsed hemorrhoids can block the passage. Right around 3 out of 4 adults will have hemorrhoids occasionally. Hemorrhoids have different causes, but the explanations are not simple enough. Let's talk about external hemorrhoids. Suggestive external hemorrhoids regularly present as a pale blue-hued blood vein simply outside the anal canal. They can form very unexpectedly and the causes vary a lot. And they can also heal all by themselves without causing any serious damage. The skin overlying the outside of the anus is pretty much entirely connected to the condition itself. If by any chance that blood coagulation creates in the anal area, the weight goes up quickly in these tissues fast and that causes extreme pain. The pain is normally consistent and can be long-term. Incidentally, the raised weight in the thrombosed external hemorrhoid brings about the breakdown of the overlying skin and the thickened blood starts spilling out from the anus, causing a bleeding session. Patients may feel extreme pain from the irregular opening of the anal canal combining with the weight, and distress, identified with external hemorrhoids that are not thrombosed. Signs and symptoms may include itching or irritation around your anus, pain, and expanding around your anus. And now let's talk internal hemorrhoids. Easy rectal draining or prolapse of the anal tissue is regularly connected with suggestive internal hemorrhoids. Prolapse is hemorrhoidal tissue originating from within that can regularly be felt outwardly of the anus while cleaning or moving bowels. This tissue intermittently returns inside instantly or can be pushed back inside by the patient. The symptoms will in general advance gradually throughout consistently if not treated soon. Or it can just go away if you stick to some lifestyle changes. How you know you have internal hemorrhoids bleeding? The bleeding from internal hemorrhoids is bright red compared to external ones and they're seen as the bleeding happens. Although not all patients with internal hemorrhoids can notice the bleeding from outside the anus unless it's in the stools. All things being equal, prolapse might be the principal or just indication. Patients may also gripe of bodily fluid release, trouble with cleaning themselves after a bowel movement, or a feeling that their stool is blocked in the anal canal with bowel movements. Patients without huge symptoms from internal hemorrhoids don't need treatment depending on their appearance alone. Internal hemorrhoids are ordinarily harmless and aggressive treatment options might not be necessary. You may, for instance, see bright red blood on the bathroom tissue or trickle into the commode. Internal hemorrhoids may also prolapse, or stretch out past the anus, causing a few painful experiences. At the point when a hemorrhoid is formed, it collects some amount of bodily fluid and small stool particles that may cause a disturbance called pruritus ani or anal itching. Trying to clean it or itching might cause more damages to the anus and the condition itself. The signs of prolapsed hemorrhoid symptoms. The symptoms of prolapsed hemorrhoids can differ. They can show up and go away frequently but irregularly, so you may just have to recognize them by paying attention. The most well-known symptoms include: first one is a lump. You may feel a lump around your anus when you wipe after a bowel movement. This is the swollen vein, and it might be delicate to the touch, or it can cause irritation. In some cases, it can be painful too. Second is bleeding. You may see blood in the stool or on the bathroom commode when you release stools, or even on your clothing in the middle of bowel release. The blood is bright red most of the time and extremely watery, rather than the blood that originates from the stomach or from intestinal bleeding, which is normally dull and dark. Third is irritation. The skin around your anus might be exceptionally irritated when you have a prolapsed hemorrhoid. Fourth is distress. The prolapsed hemorrhoids may trigger anxiety and mental stress or an extreme feeling to clear your bowels frequently, even when you don't need to. It happens because of irregular muscle movements. And it becomes even more sensitive when your stool or whatever else contacts your hemorrhoid. The weight of the stool may trigger it even more, which can cause a lot of stress for the patient. The different grades of prolapsed hemorrhoids. A prolapsed hemorrhoid happens when internal hemorrhoids swell and stick out of your butt. A specialist may allocate a grade to a prolapsed hemorrhoid dependent on how far it stands out. First grade of hemorrhoids are not prolapsed by any means. Second grade of hemorrhoids are prolapsed, yet will withdraw without anyone else. These may possibly prolapse when you put focus on your anal canal or the area around it. There are also times when you stress while needing to have a bowel movement. And then trying it again since your bowel movement was not cleared in the first place. Third grade or hemorrhoids are prolapsed, and you need to push it back in yourself. These may be dealt with so they don't turn out to be excessively difficult or contaminated. This stage is another painful time and you'd start feeling irritations and pain as well. Fourth grade or the worst grade of hemorrhoids are prolapsed, and you can't push it back in without an extreme amount of pain. It'll lead to even more painful symptoms and you'd need immediate medical attention to deal with it. It's one of the most serious stages of prolapsed hemorrhoids. Prolapsed hemorrhoids look like swollen red protuberances or lumps outside your anus, and it's visible all the way. You might have the option to see them if you use a mirror to look at them. Prolapsed hemorrhoids may have no other manifestation than the bleeding sessions, or they may cause agony or uneasiness, irritation, or extreme cases of constipation. Treatment may change by type, level of prolapse, or seriousness of your symptoms. Here are some home solutions for attempt if your symptoms aren't excessively extreme. Use an over-the-counter hemorrhoid cream or witch hazel answer for alleviating the expansion of your hemorrhoids and pain. Sit in warm water for 10 to 15 minutes. You can either fill a bath with warm water or use a sitz bath. Take pain medications, for example, ibuprofen, Advil, Motrin, or acetaminophen, Tylenol, to reduce the sensations and other symptoms as well. Use an ice pack or a cold water bottle to ease the pain and swelling. At times, your hemorrhoids may be healed to get rid of pain and long-term issues. You can also use some natural remedies to fight against it. Prolapsed hemorrhoids self-care can be self-care procedures, for example, ice packs and sitz baths can help prolapsed hemorrhoids to heal slowly. It is very important to stay away from stressing during releasing stools. You can keep your stools soft by eating foods high in fiber and drinking a lot of water. Remaining dynamic, and particularly exercising routinely, can help you reduce the symptoms of a prolapsed hemorrhoid. Caffeine is fine for your stomach, so it can help them when you are managing a prolapsed hemorrhoid. Prolapsed hemorrhoids home treatment that you can try. There are numerous hemorrhoid treatment choices accessible in the home or as over-the-counter drugs. A large number of the treatment strategies include basically facilitating the symptoms of the hemorrhoids until they clear up all alone. But here are some easy methods you can try at home. Steaming showers. Sitting in a tub of warm water that is filled barely enough to cover the legs may assist with the pain and reduce the expansion and decrease irritation caused by hemorrhoids. You can additionally decide to add different oils or other soothing items to the tub to help lessen symptoms significantly further. You can also add a cup of Epsom salts or apple juice vinegar to boost the process. Witch hazel. People ought to be careful about what is put on or applied to hemorrhoids, as they can without much of a stretch become more aroused and aggravated. A lot of people apply witch hazel straight to the external hemorrhoids to discover that they're allergic to it. Regular witch hazel is an acid, which is a substance that makes tissue contract. It also has cancer prevention agents and calming properties. They're extremely helpful on inflammation, and that is the sole reason you should use them. Witch hazel is also known to decrease wounding. Coconut oil. Coconut oil is very useful in healing inflammation, and it may likewise help with hemorrhoid symptoms. Applying coconut oil may reduce the issues caused by hemorrhoids and expand, and it might also help decrease the swollen blood sacs. Aloe vera has been used by a lot of people to treat health issues for years, and that's not all. As indicated by research in Biomed Exploration Global, the plant has a mitigating impact on the body and may help recuperate wounds. Aloe vera may give help from constipation, irritation, and swelling brought about by hemorrhoids when applied to your anus, especially on the hemorrhoids affected area. Virtue is significant, as added substances and additives can aggravate symptoms. Ice packs. Applying ice or cold packs to hemorrhoids may also help ease pain and aggravation. Applying an ice pack while situated or when hemorrhoid causes bleeding sessions can help numb down your pain and incidentally lessen expansion. You ought to make sure to wrap a towel around the ice to stay away from harming the skin. Leave the ice pack on for 15 minutes and redo the cycle hourly. Over-the-counter prescriptions. In situations where direct medications are not enough or the pain is excessively extreme, over-the-counter medications and creams may give a lot of help instead of looking for more aggressive treatment methods. Non-steroidal mitigating drugs, for example, acetaminophen or ibuprofen may help. Applying creams to the skin that contain fixings, for example, hydrocortisone could give transitory help too. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. Hope the video was helpful for you. For more articles and videos, go to healmyhemorrhoids.com or this YouTube channel.